Hello everyone, myself Dr. Jyotirmay Hegde, lead consultant and head, Department of ENT at Aster Hospital Whitefield. So today I'll be talking to you regarding tonsils. So very commonly used term tonsils, and a layman term it's very commonly used. Any kind of throat pain, they say I have tonsil. So one of the most common presentation of tonsillitis or infection of the tonsil is usually throat pain, and it happens both in the childhood age group as well as in the adulthood. But most of the time it happens in children or childhood age. So what are these tonsils? They are nothing but a fleshy tissue, basically lymphoid tissue, which happens to be the first line of barrier in protecting us. But sometimes what happens in case of trying to protect the body, if the bacteria may lodge inside it and it may cause infection, and it in turn undergoes tonsillitis. So this tonsillitis or infection of the tonsil may be a short lasting one, which is called as acute tonsillitis, or it may go on again and again and again. It is called as chronic tonsillitis, wherein you have repeated episodes of infection. So when you have an acute tonsillitis, that's an initial short lasting episode, you will come to know and examine it in the OPD. So once we see it in the OPD, we will come to know that there is an infection of the tonsil, and it will be very red, swollen, which indicates that the tonsils have been acutely infected. So that usually is managed with medicines, antibiotics, and we take care that all the infection is cleared. However, when you get a repeated episode of tonsillitis, it's happening again and again. In such cases, we'll have to manage, first try with medically, with regular gargling, and if required, a course of antibiotics, and take all precautions, avoiding any cold food, cold drinks, oily fried food, avoiding allergens, and avoiding AC. All these things will be the preventive measures. If those preventive measures, conservative measures work out, well and good. If not, when you consult us in the OPD, we'll come to see that the tonsils may be severely infected and it may be happening on and off. In such cases, it may not be a good decision to stay with the medical line of management. We will have to make a decision to go in for a surgery, that is removal of the tonsils, that is called as tonsillectomy. Because this tonsils, repeated infection will cause throat pain, fever, you will be having a very bad day, you will not have the stamina, you will not be able to eat, and it takes a toll on the body. So to avoid such things, when it is a burden on the body and it is causing bad to the body rather than any help, you have to go for a tonsillectomy. There have been various courses, types of tonsillectomy over a period of years, but nowadays what is preferable is called coagulation-assisted tonsillectomy. The advantage being that the chances of bleeding are much less during and after surgery, and after the surgery the pain also is much lesser compared to the conventional surgery. So this is very important that you do not ignore the symptoms of tonsillitis. Consult us or ENT specialist at the earliest, and we have all the facilities at the Department of ENT at Aster Hospital Whitefield, and I request you to make the good advantage or use of it, and please don't hesitate if you need to consult us for any help. Thank you.